This is a review from the class lecture, Chapter 7 of the Lewis book on stress management. Stress is adopting the right attitude and convert a negative stress into a positive one. A nurse's initial strategy should always be to further assess stressors in a patient's life. When we talk about exercise, guided imagery, or understanding how to use coping strategies that worked in the past, might be of assistance to the patient in their present. But more assessment is always needed before a nurse can determine this. Stress occurs as a response to demands that are placed on a body or on a person's mind, and stress is a perception and is very individualized. It is linked to 3 of the leading causes of death: cancer, accidents, and suicide. It's estimated that 1/3 of Americans are living with extreme stress. Emotional and physiological stressors can be positive or negative. The key aspect of stressors is that they require an individual to adapt. What is emotionally or physiologically stressful to one person may not even be stressful to someone else. Circumstances and events are stressful only if the person perceives them as a stressor. Example of adaptation affected by type, duration could be an individual dealing with chronic stress of caring for a loved one. Now, an initial hypertensive episode that occurs in response to an acute stress does not increase the risk for health problems. The increase for health problems is that they have a long-term history of hypertension. Examples of stressors. Once the environment, event, or stressor stimulates the central nervous system, multiple responses happen through activation of the hypothalamic, pituitary, adrenal axis, and the autonomic nervous system. Remember, your initial action should be to further assess the stressors that are in the patient's life. So finding out what they used in the past is going to be really good to help assess their coping mechanism. Research has shown that music with 60 to 80 beats a minute, music without words, and music composed by Mozart are frequently recommended to reduce stress. But remember, each person responds individually to music, and personal preferences are important. When using imagery for relaxation, a patient should visualize a comfortable and peaceful place. The goal is to offer a relaxing retreat from the actual patient environment. Also, optimists tend to recover more quickly from an illness than pessimists. People with pessimistic attitudes tend to report poorer health compared to those with an optimistic attitude. Relaxation breathing is probably the easiest of the relaxation techniques to use and to teach. General adaptation syndrome. When a stressor is of sufficient intensity to threaten the steady state of homeostasis of an individual, this will lead to a series of physiological changes that promote adaptation. The alarm reaction is a temporarily decreased resistance, and it may result in a disease or death if the stress is prolonged and severe. Resistance. Adaptation occurs, or if a person advances to exhaustion. During this stage, physiological reserves are mobilized to increase the resistance to stress. The amount of resistance to the stressor varies among individuals. So depending on the level of physical functioning, coping abilities, and total number and intensity of the stressors that they're experiencing. So an example is, if a patient has been exercising regularly and is physically fit, will have a greater ability to adapt to stress of an emergency surgery than a person who is deconditioned and has a sedentary lifestyle. Although few physical signs can appear, a stressed individual is expanding energy in an attempt to cope. The resources available to the individual limit their adaptive energy, and these resources include an individual's internal physical and psychological reserves, as well as their social support. The final stage, exhaustion, physical symptoms of an alarm reaction may briefly reappear in the final effort by the body to survive. This stage can be reversed by external sources such as medication. Interrelation of body systems. Neurochemicals link the nervous, endocrine, and immune system. The communication among these 3 systems is bidirectional, and stress affects these 3 systems. Activation of these systems affect other systems like cardiovascular, respiratory, gastrointestinal, renal, and reproductive. A person's response to a stressor determines the impact that stress will have on the body, and so the body responds physiologically to both actual stressors and perceived stressors. In the nervous system, the cerebral cortex plans a course of action after evaluating stressor in light of past experiences and future consequences. The limbic system is a mediator of emotions, feelings, and behavior that ensures survival and self-preservation. Reticular formation. This contains a reticular activating system to send alertness impulses to the limbic system and cerebral cortex. Stress increases the frequency of alertness impulses and leads to wakefulness and sleep disturbances. The hypothalamus. This is the central connection between the nervous and the endocrine systems. It regulates the function of the sympathetic and parasympathetic branches of the autonomic nervous system. So when an individual perceives a stressor, the hypothalamus sends signals that initiate both the nervous and endocrine responses to that stressor. It does this by sending signals via nerve fibers to stimulate the sympathetic nervous system and by releasing corticotropin-releasing hormone, which stimulates the pituitary to release adrenocorticotropic hormones. Here's another look at this. Stress activates the hypothalamic pituitary adrenal axis. So when that hypothalamus releases the corticotropic releasing hormone, it stimulates the anterior pituitary to produce the adrenocorticotropic hormone, and the adrenal cortex then secretes corticosteroids. The physiological effects of cortisol increase blood glucose levels. So this then potentiates catecholamine action on the blood vessels and inhibits the inflammatory response. The release of the cortisol, the epinephrine, and the norepinephrine increase blood glucose levels. So the physiological changes associated with acute stress response can cause changes in appetite, increased gastric acid secretion, elevation of blood glucose, increase in respiratory and heart rate. The fight or flight response. The sympathetic nervous system stimulates the adrenal medulla to release epinephrine and norepinephrine. Remember, these are catecholamines. The flight or fight response, the alarm action responses, results from the increased sympathetic nervous system activity. The corticosteroids increase cardiac output, increase blood glucose levels, increase oxygen consumption, and increase the metabolic rate. Keep in mind that the acute stress can elevate the blood pressure, and once a patient stabilizes, then go back and recheck that blood pressure to determine what is their usual blood pressure. If a patient's very irritable, then try to calm first. No one can truly listen to any of the instructions or teaching if they're irritable or they're angry. Immune system. The cerebral cortex processes stressful stimuli and relays the information via the limbic system to the hypothalamus. The corticotropic releasing hormone stimulates the release of the adrenocorticotropic hormone from the pituitary gland. I'm going to keep saying this. The adrenocorticotropic hormone stimulates the adrenal cortex to release the corticosteroids. So the sympathetic nervous system is also stimulated, resulting in that release of epinephrine and norepinephrine from the adrenal medulla. The end result is inhibition of the immune system. Now, as a result of this, the mediation of stress by the central nervous system leads to corresponding changes in immune cell activity. Acute and chronic stress can affect the immune function by decrease in number and function of natural killer cells after lymphocyte proliferation and decreased production of cytokines. It's important to note that the network that links the brain with the immune system is bidirectional, and the signals from these systems travel back and forth. The effects of stress on health. When a person sustains chronic, unrelieved stress, the body defenses can no longer keep up with the demands. And over time, stress takes its toll and plays a role in the development or progression of diseases of adaptation or stress-related illnesses. Examples of stress-related diseases include depression, fatigue, fibromyalgia, headaches, hypertension, insomnia, irritable bowel syndrome, and menstrual irregularities. Stress affects cognitive functions such as poor concentration, impaired decision-making, or memory problems. Stress also affects behavior by withdrawing from others, irritability, or substance abuse. The effects of stress on health. We've talked about the hippocampus, and it does play an important role in long-term memory and is also important for cognitive functions such as spatial learning. The release of corticosteroids in response to stress appears to act in concert with certain neurotransmitters to produce stress-induced hippocampal damage. Long-term exposure to catecholamines resulting from excessive activation of the sympathetic nervous system may increase the risk of cardiovascular diseases such as atherosclerosis and hypertension. The release of cortisol, epinephrine, and norepinephrine increase the blood glucose levels. So when a person is stressed, the hormones are released that increase their blood glucose. Control of metabolic conditions like diabetes is also affected by stress. Behavioral interventions then are aimed at stress reduction and relaxation in conjunction with standard medical therapy have been successful in helping to manage these diseases. Acute stress affects appetite, increased gastric secretions, and causing epigastric pain and increased blood glucose levels. Stressful life events can make a person more susceptible to infection. Coping. Coping resources are actions drawn on to manage stress and include factors within the person or the environment. The availability of coping resources affects an individual's ability to cope. Resources would be health status, belief systems, problem-solving skills, social skills and support, and financial. In the clinical setting, knowledge of a patient's resources will assist the nurse in supporting existing resources and develop strategies to expand the patient's coping resources. Since behavioral responses to stress include temporary changes such as irritability, changes in memory, and poor concentration, patient teaching will need to be repeated. Coping strategies can be divided into two broad categories: emotion-focused coping and problem-focused coping. Examples of emotion-focused coping are discussions of feelings with a friend or taking a hot bath. Although it may not seem to be working toward a solution, emotion-focused coping is a valid and appropriate way to deal with various situations. The purpose is to help decrease negative emotions and help create a feeling of well-being. There is also problem-focused strategy, which is thinking how behavior changes can improve symptoms. This is a technique that is used for problems that can be changed or controlled. Examples of problem-focused coping is setting priorities, collecting information, and seeking advice. The purpose allows one to look at a challenge objectively and take action to address the problem and reduce the stress. Both forms of coping can be used with stressors, and a combination of the two strategies can be used with the same stressors. When a situation is unchangeable or uncontrollable, emotion-focused coping may predominate. When a problem can be changed or controlled, problem-focused coping is the most helpful coping strategy. Relaxation strategies. The relaxation response is the opposite of the stress response. The decrease in the sympathetic nervous system activity leads to decreased heart and respiratory rates, decreased blood pressure, decreased muscle tension, decreased brain activity, and increased skin temperature. The relaxation response can be elicited through a variety of relaxation strategies, such as relaxation breathing. Remember, this is the easiest to teach. Meditation. Imagery is good, but it does take time to teach a patient imagery. This is where you want to take them to a place where they will feel comfortable and peaceful. Music for relaxation. But what is relaxation to the nurse may not be what is relaxing to the patient.